Interventional Cardiologist, practicing at Apollo Hospital, Jubilee Hills, Hyderabad. Heart failure is a condition in which the heart is not able to pump enough blood which the body requires for doing its various activities. Whenever the heart is not able to pump enough blood for the body to function, like kidneys to function, the brain to function, the liver to function, then the condition called heart failure. It's a mixture of many diseases in which few people have a heart which is functioning at lower capacity, like heart function is less than 35-40%. In some people, the heart function is normal, but there is a decrease in filling. The heart becomes stiffer, because of which there is a collection of the fluid in the lung, which we call diastolic heart failure. The first one is called systolic heart failure. And it's the heart failure incidence increases as the age increases. Typically, what we see is 10 to 15% of patients above 60-65 years have some kind of heart failure, whether it is systolic or diastolic. But in young people, the heart failure is less common. And in young people, the heart failure happens usually because of a structural heart disease, which can be in the form of a valve disease, or unfortunate people who have a heart attack in a very young age, or somebody has a genital heart disease called cardiomyopathy. But otherwise, heart failure is a disease of elderly, typically seen in people beyond 60-65 years, who can have a history of heart attack in the past, or who might not have any history of heart attack, but can have a stiffer heart because of which the filling is reduced. Yeah, when we categorize the risk factors of heart failure, the topmost one is history of diabetes, history of blood pressure, history of kidney ailment, or somebody is aging. These are the typical 4 risk factors for heart failure. And people who smoke also are at a high risk of heart failure. And the people who consume more of salt, they also carry an extra risk, because ultimately increasing salt consumption leads to increase in the pressure, which again is one of the commonest reasons for heart failure. The heart failure management depends on 3 things. One is prevention of further progression. Number 2 is the improving the existing symptoms. And number 3 is the prolonging the lifespan by additional medications. When we say preventive health care, it's a primordial prevention in which we encourage patients to have a very good control of blood pressure, taking a balanced diet of reduced salt, increase of fruits, and if they are diabetic, to control it well. If they are smoking, to stop smoking. If there are families of heart failure, get them checked very early. These are the typical things what we say to prevent a heart failure. When somebody has an established heart failure, typically we manage them by either by decreasing the load on the heart, by giving some diuretics which increase the urination, or giving some blood dilators, what we call vasodilators, which will decrease the load on the heart. Adjusting on these 2 medicines will definitely increase the heart failure, decrease heart failure symptoms, and increase the longevity. And the other thing is the newer drugs which are known to increase the survival benefit in heart failure, and few of them are also known to increase the heart function, which we have 2 categories. One which is typically given in diabetic patients, or nowadays even we give for non-diabetic like SGLT inhibitors. The most important, what we call ARNI. These are the 2 new drugs which came in the heart failure, and we find these 2 working very, very well. Manage your fluid intake well, take balanced diet, see that you monitor your weight regularly. Any increase or in the weight of more than half a kilo per week is important sign to monitor. If you any point of time see that your weight is increased by 500 grams over a period of week, consult your doctor and see that you don't consume more of salt. Always salt should be less than 3. And most important, never skip any medication, and always be updated with the doctor to understand any new therapies coming in, because heart failure is a dynamic topic which is evolving very, very fast. Therapies which you didn't even think 2-3 years before were possible are now into the realm of medicine. Patients should be very careful about the diet and do some regular physical activity. And the medication is a paramount in heart failure. Not skipping medicines, taking the appropriate medication is very, very important. Patients should understand that heart failure is a dynamic disease. The medication do change in period of time. Some people with a very good control heart failure, we try to increase the medicine. Somebody has decompensated, we try to give some of the medication. So always be in contact with the doctor. Probably a 1 to 3 monthly visit should help in decreasing the chance of getting readmitted. And when we start patients on newer medication, the chance of readmission is much lesser. Typically, the newer medicines are called ARNI, which have been shown to decrease the rate of readmission in patient with established heart failure. And our goal is, number 1, to increase the lifespan of the patient. Number 2, make him more comfortable. Number 3, decrease the chance of he getting admitted. All these 3 targets are met with new molecules.